Hello everyone. So in this video on obstetrics, so we will be starting a new chapter on normal labor from today. And today in this video we will be mainly talking about the definition and introduction about normal labor and its causes. And from next video we will be move on to the main topic of that is necessary. And so talking about labor, the it is defined it as some long definition taken from Dutta, and usually the teacher expect to write this definition from the book as it is in the exam. So better it is to mock up this definition. So what is labor? Labor is a series of events that takes place in the genital organ in an effort to expel the viable product of conception, that is fetus, placenta and the membrane out of the womb through the vagina into the outer world, and it is called as labor. So we will repeat it again. Normal labor is a series of events that takes place in genital organs in an effort to expel the viable product of conception like fetus, placenta and membrane to the out of the womb through the vagina in the world outer world is called labor. So it may occur prior to 37 completed weeks and when it is called preterm labor. And there is next term known as parturition and parturition. So what is parturition? The a parturition is a patient in the labor, that is the mother, and the parturition is the process of giving birth is known as parturition. And the labor is characterized by presence of regular uterine contraction with effacement and dilatation of the cervix with the fetal descent. And there is next term is delivery versus labor, and these are not the synonymous term. Delivery is the expulsion or extraction of viable fetus out of the womb, and delivery can takes place without labor also. And the delivery, such as in the elective cesarean section, the delivery can occur without labor. And the delivery may be vaginal, either spontaneous or ADS, and it may be in the abdominal. So that is a delivery is the expulsion or extraction of viable fetus only, and labor includes all of the process that takes place in genital organ and to expel all the product of conception including fetus and all those placenta and all those things that includes labor. So what is normal versus abnormal labor? Talking about normal labor, it is also known as eutosia, and abnormal labor is called dystocia. And labor is called normal if it fulfills the following criteria. It should be spontaneous in onset and term. Labor should be at term and with vortex presentation or cephalic presentation with the vortex at the presenting part, without undue prolongation, and natural termination with minimal aid, and without having an complication affecting health of the mother and the baby. So and abnormal labor dystocia means any deviation from this definition of normal labor. Any deviation from these are known as abnormal labor. And talking about causes of onset of labor, the precise mechanism of initiation of human labor is still obscure, but endocrine, biochemical and mechanical stress pathway as obtained from animal experiment put forward some hypotheses for the causes of onset of labor. First one is uterine distension. Stretching effect on myometrium by growing fetus and liquor amni can explain the onset of labor, at least in twins or polyhydramnios. And the fetoplacental contribution, like the various cascade of event activate fetal hypothalamic pituitary adrenal axis prior to onset of labor, whereas the cascade of event activate the fetal hypothalamic pituitary adrenal axis prior to onset of labor. That causes release of corticotropin releasing hormone that causes increased CRS, and increased CRS causes increased release of ACTS from the fetus. Parturition cascade, placenta release CRS causes act on fetal hypothalamus, and that causes fetal pituitary to release ACTS, and fetal adrenal produce increased cortisol secretion, and that cortisol secretion also there is increased production of estrogen and progesterone from the placenta. The fetal liver helps in production of estrogen, or cortisol also release, and all these can cause other these all increase in the help in the onset of labor. The estrogen probably helps in onset of labor by that it increases the release of oxytocin from the maternal pituitary, And estrogen also promote the synthesis of myometrial receptor for oxytocin, prostaglandin, and increase in graph junction in myometrial cell. And it also accelerates the lysosomal disintegration in decidual and amnion cell, resulting in increased prostaglandin F2 alpha synthesis. And estrogen also stimulates the synthesis of myometrial contractile protein actinomyosin through CAMP, and it also increases the excitability of myometrial cell membrane. And after estrogen, the contribution of estrogen, the progesterone, the increased production of fetal dihydroepiandrosterone sulfate and cortisol inhibit the conversion of fetal pregnenolone to progesterone. So progesterone level falls before labor, and so due to that there is alteration in the estrogen progesterone ratio, and that causes the onset of labor. And next is prostaglandin. They are a very important factor which initiate and maintain labor. The major site of synthesis of prostaglandin are amnion, chorion, residual cell, myometrium. The synthesis is triggered by rise in estrogen level, glucocorticoid, mechanical stretching in late pregnancy, increase in cytokine, infection, vaginal examination, separation or rupture of membrane, and prostaglandin enhance gap junction, gap junction formation. So these are all causes, and also now we have the contribution from oxytocin. The large number of oxytocin receptors are present in fundus compared to lower segment and cervix. The receptor number increases in pregnancy, reaching maximum during labor, and the receptor sensitivity increases during labor. And oxytocin stimulates synthesis and release of prostaglandin E2 and F2 alpha from amnion and decidua, and vaginal examination and amniotomy, that is stretching of lower genital tract, cause rise in maternal plasma oxytocin level, that is also known as Ferguson reflex, and the fetal plasma oxytocin level is found increased during the spontaneous labor compared to that of mother. Its role in human labor is yet not established. And the neurological factor, although labor may start in denervated uterus also, labor may be initiated through nerve pathway, like both alpha and beta adrenergic receptor are present in myometrium. The estrogen causing alpha receptor and progesterone causes beta receptor to function predominantly. And the contractile response is initiated through alpha receptor of the post ganglionic nerve fiber in and around cervix and lower part of uterus. So this is the mechanism we just talked. The activation of fetal hypothalamo-pituitary axis, and this is called release of cortisol. It acts on placenta. There is decreased progesterone from placenta. There will be increased estrogen level, decreased progesterone level, and estrogen causes the maternal posterior pituitary to release oxytocin, and this causes activation of myometrial contractile system. And oxytocin also causes placenta, amnion, and chorion decidua to secrete. Again, these all produce oxytocin themselves. Prostaglandin E2 alpha increases, prostaglandin F2 alpha increases, CAP, that is about what is CAP, contraction associated protein increases, and nitric oxide also level increases, and these all causes activation of myometrial contractile system, altered balance. So this is the mechanism how the initiation of labor takes place. Thank you. That was all. Now in next video we will talk about we'll further continue about next topic in normal labor.